Good morning. My name is David Renker, and I'm with Eisenhower Medical Center. And Sharon asked me to do a presentation specifically for the Canadians that live in this area because there are so many Canadians, number one, and number two, we see a significant number of Canadians that are engaging with our health services all over the valley. So she asked me to come do a quick presentation for you on how we can assist Canadians navigating the health system here, because we know it's completely different than what you deal with in Canada, okay? So what I gave you is a packet, and I'm only going to talk to you for 10 or 15 minutes. I'm just going to give you a quick overview of some things that we try to give to Canadians to help you through the system. And then obviously at the end, if you have any questions about anything that I've presented, please feel free to ask, okay? So the first thing I wanted to cover with you is if you open that packet up that I gave to you, there is a sheet of paper in there that says, is it an emergency or just an urgency? Okay? And we put this together specifically a couple of years ago because we had so many Canadians coming into emergency at Eisenhower for things that were not necessarily emergencies. But because of the difference in your systems in Canada and what we do here, it makes sense that you would come to emergency. And so consequently, what we have created is we have 3 different urgent cares around the valley, which are what we call places to go for things that aren't necessarily an emergency. And what I really want to be clear about is that if someone thinks they're having a heart attack, or they're extremely dizzy, or they think they had a stroke, or there's something really, really, really scary going on, you need to go to emergency. Absolutely go to emergency. And what we've done on this piece of paper is tried to clarify for you what the difference is between an emergency and an urgency. But let me also say that yesterday I was in our emergency department at 2 o'clock in the afternoon, and we had 180 people in emergency, okay? 180. And at the end of the day, when we tabulated everything last night at 11:30, 98 of them were there because they have this bad cold and flu that's going around, okay? So the good news is they went to get care and they got care, but the bad news is there were so many people there that some of them had to wait 5 or 6 hours because the people that have the real emergencies are the ones that get handled first. So whole point of that is just to explain to you, and if you turn over to the back side, we delineate this for you where we say where to go for medical care. And we just give you some rough symptoms. If you think you've got a fracture or a sprain or something along those lines, or maybe you're running a fever, an urgent care is a place for you to go where you'll get much quicker service and you won't be stuck in a queue waiting with 175 or 190 other people, if that makes sense, okay? But again, I want to specify relative to anything related to obviously a heart attack or some bleeding that won't stop or some kind of an emergency that you really think you have, you want to go to emergency. But we just put this together because we think, this is important, and we had so many Canadians coming to us and going, oh my gosh, I went to your emergency room and I had to wait for 5 hours. And I get these phone calls and my response is, well, what was the reason that you went? Well, I was running a fever, I had a fever of 102. I said, well, we had 4 people that had had heart attacks, and we had 6 people that had had strokes, so I'm so sorry that you had to wait, but it's just sort of the reality. But urgent care would get you in really quickly if you were running a fever or something along those lines, okay? So that's the first piece, and we just wanted to help you kind of walk through that, okay? The second thing that I wanted to quickly go over with you is it's called the urgent care price list, and each one of you should also have that in there. It says cash pricing for urgent care. Does everybody have that? I hope. Okay. Yeah, so we put together this piece of paper for all of our Canadians because you may not know this, but we think we figured it out. There are over 200,000 Canadians that come here in the wintertime. That's a big number. And our population of this Coachella Valley in general, just this Coachella Valley, when we're not in the middle of season, is roughly 500,000 people. But in the season, the population swells to basically 1.4 million. Okay, so we have 1.4 million people driving around this Coachella Valley, January, February, March, and April, and about 200,000 of those are Canadians. So there's a lot of Canadians. Obviously, in your communities out here, lots of Canadians in La Quinta, lots of Canadians in Indio, lots of Canadians in Palm Springs. So our various urgent cares now are being hit by Canadians that need things. And so the question that every Canadian comes in and says is, how much is this going to cost me? Because your situation in Canada is so different, right? Because it's covered by your system. So we put together this basic charge list for you in case you ever need to go to an urgent care. Important for me to specify that if it was an emergency, back to the emergency piece, it's impossible for us to tell you what that's going to cost you because it's an emergency and we don't know exactly what's going to be needed, so we cannot predict that. But this will break out for you just some basic things. So I'll just give you like a quick example. We listed out a basic visit, an intermediate visit, and an advanced visit. And a basic visit would be if you had some kind of wound, or you came in and you needed some ibuprofen, or you really had this bad headache and you weren't sure, and it was just like a basic visit to urgent care, like the flu, you're running a little bit of a temperature. The cash price is all rolled into one price, which is $125. And we did it that way because in the US system, if you're a US person on our healthcare system and you go to urgent care and you have the flu, you might get 6 bills. Because of the way our system is, which is completely, as you know, very complex and kind of messed up. And they're trying to fix it. But you will go into urgent care as a US system and you just have the flu and you have a temperature and you just want to be spoken to by a doctor. You pay for a visit to the facility, you pay for whatever medication they give you, you pay for the doctor's time. If you need something that's out of the ordinary, you pay for that. We send all these bills in the US system and it's so confusing. And we know that for you as a Canadian, it's even more confusing because you're out of your own country and you're like, what are these people doing? So we broke down the pricing for you to keep it very simple. So it's one cash price and you know exactly when you get there. And then if you have to go back to your insurance company that you're using for your traveler's insurance or your emergency insurance, you can do that. And you can say, yeah, because I know, we find that 99% of you have to call, right? If you have something, you're supposed to call your insurance company. Right. They might say to you, and they often do because they call us for these prices, they might say, what's the problem? What are you doing this for? And you tell them, and if you find us on this list, you can say, hey, you know what? I am going to need a clinical visit for a cold and I'm going to urgent care. Whether or not you have that covered in your insurance is kind of a decision that you make when you buy your insurance, but this breaks out that pricing for you. So we have basic visit, an intermediate visit, and an advanced visit. And then the other part that I put on here for you is additional urgent care testing or imaging charges. We have a lot of Canadians that will come and say, I would like to get an x-ray. If you're in the US system and you came to us today and said you needed an x-ray, we would charge you $450 because of insurance, because of the way our system's set up. If you're a Canadian, it's $50. Because we know it's just you're going to pay cash. If we could get cash, that would be great, but we can't because everybody uses insurance and it takes 2 million years to get paid. And I hate to be so blunt, but we're frustrated with our own system. And we've tried to make it as easy as we can for you as Canadians. So simple things like that. So an x-ray per body part is $50. If somebody needed an ultrasound for whatever reason, because your doctor in Canada said to you when you called, I've got such and such an issue, your doctor says, you need to go get an ultrasound and then let me know what the results are, you can come to us and we'll give you an ultrasound. And it's simply one price. Yes, sir?
Is that on top of your basic charge?
Yeah, that'd be in addition to your basic charge. That's correct. That's correct. Okay? We do also have a lot of Canadians that come to us because their doctors in Canada have said we need an MRI for whatever reason that you might have. If you were to get an MRI in the US healthcare system today, if you came to us and said, hey, I need an MRI, we couldn't get you in today, but we'd get you in on Monday or Tuesday, it would cost you $2,000 for an MRI. For you as a Canadian, it's $450 for an MRI per body part. So quite simply, without belaboring this issue, we just really wanted to simplify it for you because there are 200,000 of you and we have so many of you engaging with our system and it's so confusing, we thought we need to simplify this. So this will give you a little bit of a roadmap of how we do that. Okay? Yes, ma'am?
I'm just curious, would you charge Americans the same amount if they were willing to pay cash?
No, if American was willing to pay cash, they would pay the cash price. Right, but the thing is, 99.9% of the Americans don't want to pay cash. They want to use their insurance. So, okay, so that's kind of just a quick guide on that. I don't want to get you into too much detail with it. Forgive me if I have.
So you wouldn't direct bill a Canadian insurance company then?
We can't do that because that's against the law. That's against US law for us to do that. So when you're setting up your insurance, you obviously need to figure out how that,
But if I had insurance with an American company?
we would bill the American company. Right. Okay. Also on the left side of that piece of paper, same thing, I just gave you a breakdown of urgent care versus emergency. And then on the back side, locations for those urgent cares. Okay? So that was part 2. I just have 2 more parts with you, and then I won't go on too much longer. We also have a lot of Canadians that come to us that are looking for a primary care doctor. Okay? You in Canada may not know this, but I can tell you that in the United States, this is a huge issue. There's a severe shortage of primary care doctors across the United States, right? And in Canada. Okay, then you have the same problem. Right, okay. So there's a bunch of reasons for that that I won't get into here. But because of that, we have a lot of people that call our physician referral line when they're here and they say, hey, you know, I'm looking for a doctor. Can you get me in to see a doctor? Yesterday I had somebody who called who needed a doctor, and the first appointment I could get him was on March 18th. It's January 7th. Their issue is kind of significant to them. They'd like to see a doctor in the next week. They can't because there are not enough doctors. We don't have enough doctors. JFK doesn't have enough doctors. Desert doesn't have enough doctors. So what we did to kind of help that program was create this program that we called Eisenhower 365. And I am not here to sell you on this program. I just want to make you aware that it exists. You're all familiar with how concierge medicine works, right? We have a lot of concierge doctors in the Valley. If you paid the $2,000 or the $5,000 that you would pay on an annual basis to have a concierge doctor, you could call them on Friday of yesterday, or you could call them today, and they could probably get you in on Monday or Tuesday because you're paying this big annual fee, and that's what they have to do. We had such a significant demand for that, and because we're not set up for concierge medicine, that we created what we kind of like to call concierge light, okay? And we created this program called Eisenhower 365, which gets you in to see a physician immediately. And if you're a frequent visitor to the Valley, if you come here every year and you're here for 4 or 5 months and you want a physician in this Valley, you can actually be a part of this program. And you pay a fee, it's an annual fee. And what it does is get you access to a doctor more immediately than having to wait until March. And when you do have that access, we set you up with email so that you can email with that doctor 24/7, first of all. And second of all, we set you up so that you have communication with that doctor when you need it. And third of all, we help you coordinate the care that you might need. So let's say you go in to see your doctor on Monday and your doctor checks you out and says, you know what, you're going to need 3 x-rays and you're going to need to go to our lab because we're going to need to draw some blood. If you're going to a normal primary care doctor right now in the desert and you try to do that, your doctor could tell you to do that, and then it could take you 3, 4, 5, maybe even 6 weeks to actually get an appointment with a lab because there's such a big shortage. So this program we created called Eisenhower 365 streamlines all of that and navigates it for you so that if you need to go get a lab or you need to get some imaging, we help coordinate that piece of your care. Does that make sense?
I just want to know the price of that.
So it's $595 for anyone that's 55 or older per person. And then if it's for a couple, it's $1,050. And that's an annual fee. And again, this presentation is not to sell you on that. I just want you to be aware of that because I have so many Canadians that call me and say, I need to see a doctor. And you know, we do the best we can, but we can't get them in. And then we end up recommending, if it's really urgent, that they go to urgent care. But this program actually helps a lot of people, and we have about 9,000 people in this E365 program, and about 2,500 of them are Canadian. and they're Canadians that are here in the winter and they want a primary care physician because they've got some ongoing issue, and they're away from home for 5 months, and they want the safety and the security of knowing that they have somebody they can go to. Yes, ma'am?
So are these physicians able to work with people who have chronic illnesses like Parkinson's?
Yeah, absolutely. Yeah, so in that packet, you have a list of who those physicians are. And if you wanted to learn more about that, there's a phone number in there and we could tell you more about that, but I don't want to take up all your time with that right now. I just wanted you to be aware of that, okay? Okay, then the last piece was we have also a program at Eisenhower specifically for Canadians called our Canadian Access Card Program. There's no fee involved with this program. It's just something we do for Canadians. We created a card 3 years ago. We call it the Canadian Patient Access Card, and I'm going to pass it around. It's about the size of a credit card. And we have about close to 6,000 Canadians that have registered for this card. So if you want to pass that around, that'd be great. And basically what it is if you, again, we're not trying to sell you on anything, this doesn't cost you anything, but if you wanted to register, we have a registration sheet in your packet. And what you do is if you fill this registration sheet out, we will put your information in the system so that if you show up at an urgent care, or you show up at the hospital, or you show up at one of our various clinics, you're already in our system and we don't have to go through this whole rigmarole of who you are, where you're from, here are the 2 different addresses. And then this card lets our staff know, because we have 5,000 employees in this valley, it lets our staff know that you're Canadian. So we're not dealing with the same situation that we're dealing with insurance and checking insurance companies in the US, because we always have to verify insurance for people that show up at any of our clinics or the hospital. So this expedites the whole process for you. And the other thing it does is it gives you access to our Canadian special pricing, because we've set up some special pricing for certain elective surgeries for Canadians. Okay, what does that mean? Yesterday, I had a Canadian who had a double knee replacement. He got on a list in Canada 18 months ago to get his knees fixed, and he couldn't get them fixed. And he was so frustrated that he called us about a month ago and said, I am so frustrated, I just need to get my knees fixed. Can you help us? Or can you help me? I said, yeah, we can help you. And what we did is we set up pricing for certain elective procedures. We can't do it for everything, but especially orthopedic, cash pricing, so that if a Canadian, is in a position where they could actually pay cash for that and they wanted to get it done because they didn't want to wait, they could do that. So I'm not sure, if that's something in here that any of you are interested in, but this card gives you access also to that pricing. And we find that most of our demand for this is orthopedic, as I said. We also have a lot of Canadians that come to us that are looking for things as simple as, or maybe not quite so simple, but a colonoscopy. They're trying to get a colonoscopy in Canada. They can't. It's going to take 4 or 5 months. They want to get it done. They do that. Little things like that. So, but we see a lot of hip. We see a lot of shoulder. Anything related to orthopedics is really big, as you can imagine, because we're all in an aging population. So the last part of that is those prices that we have set up, and I'm not even going to get into that kind of detail with you here right now, but those prices we have set up, we call bundled prices. And what we've done with that also, we've created one price. So I'll give you an example of that. The person that's getting the knees done, it's one price, and I won't get into what that price is, but it covers his initial visit, the x-rays, the meeting with the doctor, the surgery, and all the follow-up. One price, one bill, so that you don't get the 14 other bills that you would get if we billed you for anesthesia and we billed you for the facility fee and the x-rays and the doctor and all these crazy bills that start coming in, because about 3 years ago, we had a couple Canadians come in and we charged them. And this one particular man called us after about a month, and he was very, very happy with how his knee surgery went. He was thrilled, and he was actually willing to do a grateful patient story for me. He said, I'll do a grateful patient story. And then so we had the story written. And then about a month later, he got 3 bills. And then 2 months later, he got 3 more bills. And then another month later, he got 2 more bills from our hospital, because of the way our system is so set up. So we said, okay, one price, here's all the things that you get This is what you pay, and we work that all out so that you don't get all these multiple bills, and you know exactly what you're getting when you come in. All of that to say, this card, if you're interested, we can put you in the system in case you ever show up at an Eisenhower location and you need assistance. You're not going to get a bunch of emails. You're not going to get mailed a bunch of information. It's just an access card that lets our staff know you're Canadian. We need to deal with a single cash bundled pricing, and you're working off a different system. Okay? So if anyone is interested in that, you're welcome to fill that out. I would be glad to have those loaded in the system for you and sent to you. And if you're not, that's okay too. You can, come whenever you come, and actually, hopefully, you don't ever have to come. We'd prefer that if you didn't come. And you can also go online and do this if you'd like. Correct. And we will then mail you the card. Yeah, and so do you have Eisenhower's or do you?
This is Eisenhower.
Oh, then that's the one you have.
I'm
Yeah,
Desert
right.
If you have Desert Regional,
Yes,
that doesn't necessarily mean your information is at Eisenhower.
absolutely not.
That's what I
Yeah,
hear.
we're completely different. We're actually, Eisenhower's a not-for-profit hospital. So we're this single entity. Basically, we're a charity. And we live off of the donations that we have from the many donors that we have, as well as the Medicare reimbursements that we have. But completely separate. Desert's part of a health system. Yeah.
Good to know that.
Yeah. Yes, sir.
Is that card only good for California?
Yeah, because Eisenhower's only located here in California.
So it's just Eisenhower alone, so if you were traveling back to Canada, something happened, it's no good.
No, because our Eisenhower's network is just right here in the Coachella Valley. So if you went to, God forbid, if you had to go to urgent care next week and you showed up with the card, we'd have you in there and we'd already have all your information. You can also give us your emergency information in terms of who we contact in case you're solo and somebody's in Canada, and we have all that in the system so we know what to do and how that all works. Yes, ma'am.
So earlier you had said you can get access to a physician for $5.95 or something per person, but you would still then pay the office visit fee on top of that, right?
That's correct. That's correct. Now, if you're in the U.S. health system, which we have many people that are part of this program, they obviously don't have to pay for that office visit because Medicare reimburses that, or reimburses 90% of it.
And if you have travel insurance, would that reimburse?
That's a dicey one, and it just depends on what your Canadian travel insurance company is willing to do. Now, we have had some Canadian travel insurance that has said, yeah, we'll pay for that. It's because you're paying that premium.
Nobody's not pre-existing, if you come in with pneumonia or something.
Right. So it just depends on who you use for your traveler's insurance up there, and we're not really allowed to get into that because it's, we're US and that's Canada. But the only thing I could tell you on that is there is one particular travel insurance company that we work pretty closely with. I would say probably 80% of what we do is a company called Medipac.
Oh, yeah.
Do you guys know Medipac? We find Medipac to be, fairly good. And I don't understand how what kind of premiums you would all be paying for certain things that you want, but yeah. Yes, ma'am.
No, I'm just going to say 5 minutes.
Oh, okay, good. Well, actually, I'm kind of finished. So if,
Q&A for a minute.
yeah, if anyone has any other questions, I'd be glad to answer them. Yes, ma'am.
You choose to come to Eisenhower as a Canadian for this system where everything is one bill. Does that include your choice of orthopedic surgeon? Does that include your surgery? Does it include your rehab?
Absolutely.
Everything at one price, even your choice of surgeon.
Absolutely. So if you said, hey, I need for knee, we would say, okay, here are the 4 doctors that we have that would do knee surgery. We'd give you bio cards on them or let you research them on our website. And if you decide to do that, here's what I would tell you. Just a little US piece of knowledge. You want to look at the number of surgeries they've done. You always want to know about that. How many surgeries has this doctor done? And secondly, what's the outcome percentage? Are their outcomes high? Because, generally we only carry doctors that have great outcomes, but you just always want to look at that, whether it's Eisenhower or anywhere else that you would go. Ask about outcomes and ask about number of surgeries the doctors have performed, just to give you a little bit of peace of mind. Yes, sir.
Just not so much a question as a comment, but I think most people have probably got deductibles on their, Canadians have got deductibles on their travel insurance anyway.
Right.
To keep the price down, which means that you providing us with some pricing so we have an idea what it's going to cost us when we go is a really good idea. I'm not talking about elective here, I'm talking about if you've got to go in because you broke your arm or something like that.
Right.
At least you know what to expect, because your insurance is not going to cover that.
That's right.
It's probably under your deductible.
That's exactly right. That's why we did it. That's really the bottom line on what when we figured that out. We got to let them know so they can figure out what they're doing with their insurance.
Yeah, thank you.
Yeah. Thank you for your comment. Yes, sir.
Do your pricing, does it vary year to year? Do you reevaluate on a yearly basis?
That's a great question. The pricing I just gave you for any urgent care visits at the basic 1 level, 2 level, 3 level has been the same for the last 3 years. No talk that I've heard of it changing, because if it did, they'd have to tell me, because I'm getting it out to the masses. But it's a great question. And then on the elective side, that pricing has not changed either in the last couple of years.
So it's not fluctuating over.
No, but you know what? It will, because it's all escalating. So, but right now it's pretty safe. I know it's safe for this season.
Okay.
Yeah. Yes, ma'am.
Early on, you said that there was a shortage of doctors here also, what we experience in Canada. How long would a waiting period be here if you had elective surgery?
If you had an elective surgery,
Yeah.
we would probably have you come in for a visit to be for an assessment of what you need within 2 weeks of the call. And then I would bet the surgery would probably be within 2 to 3 weeks of that.
So 5-week period.
Probably 5 weeks, yeah. And what is happening with a lot of the Canadians is we're getting called in September and October, and they're lining up for November, December, and January.
Okay.
So then they get this, like the knee surgery, they might get it done right after Christmas, and then they use the month of January to recover and also continue to access the doctor.